السلام عليكم.
وعليكم السلام.
Okay. Inshallah, we will make rapid revision about the anatomy of Resp in this block. Inshallah, will be easy. And I will ask you, inshallah. Okay. Inshallah, we'll start first by the bony of the chest wall. As we said before, how many vertebrae we have in the thoracic wall?
12.
Yes. And inshallah, we will have typical and atypical. Yes? Typical and atypical. Okay. Let us start with the bony feature of the vertebra as the general, and you must know the specific features of the vertebra, as we said before. Okay. Please identify this labeled
Spine.
Identify.
Body.
Spine.
Yes. Identify.
A transverse process.
Identify.
Superior.
Superior. Huh?
Socket.
Superior.
Articulation.
Yes, yes. Superior articular process. Yeah. Articular. From articulation. Identify.
Lamina.
Yes, yes. Very important because there is a ligament here. Lamina. Okay. This is the first step. The second one, you know this canal? This one? What is the name?
Transverse foramen.
No. Please identify.
Vertebral foramen.
Yes, vertebral foramen. Vertebral foramen. Okay. Okay. The second question here, please identify the name of the vertebra, as we talked before. Okay. Identify this one.
Typical.
Huh? Again?
Typical.
Typical.
The last one. The last vertebra.
This is the last one.
The first vertebra.
This is the first one. Yes. Why? Why this is the first one? I will tell you. The spine directed backward only. And also, if you see here the body of the vertebra, you will see here one complete facet and a small demi-facet. Okay, top here, identify this vertebra. Identify this vertebra. Yeah?
Typical vertebra.
Typical. Why this is typical vertebra?
The spine is directed back, downward.
Yes, the spine here is directed downward and backward. And also from the theoretical level, it is here two demi-facet. Two demi-facet. Half and half. Okay? Okay. Please identify this vertebra.
Last one.
The last one, yes. Why this is the last vertebra? Last thoracic vertebra.
The spine is
thoracic.
short spine.
Yes, short and wide.
And big body.
And the big
And
body
thick
and the big
body.
spine. Spine also it is big. Here, regarding to the first and the typical, this is the typical one. The spine here is narrow. Okay. This is regarding to the thoracic vertebra. We will shift to the next slide. As we said before, name the vertebra, name the facet. The facet, this is named, we have two facets in the body of the vertebra. The upper one is superior articular facet and the lower one is lower or inferior articular facet. And we name the vertebra as before. Okay, here. This what?
Sternum.
Sternum. The first one, the first thing in the sternum, you must know the three part of the sternum. This one named, identify this part.
Manubrium. Sternum.
Manubrium sternoi. This one.
Body of
Body. This one. Xiphoid. Okay. The joint in between the manubrium and the body named. Oh, name the vertebrae. Name.
Angle. Secondary cartilaginous.
Yes, but please remember the questions like that. Please identify or name. Okay, name this. This one is external angle. If I ask you type of joint, yes, it is secondary cartilaginous. Type vertebral level. Vertebral level.
T3, T4. 4 and 5.
Yes, 4 and 5. Till now, you are confused about the level of external angle, T4 and the T5. What is the level, vertebral level of the manubrium? The manubrium sterni. What is the vertebral level of the manubrium sterni?
T1.
T3 and 2.
3 and 4.
Yes, T3 and 4. Nice. Type, what is the vertebral level of the body?
T5 T8.
Yes, T4, 5 till 8.
8.
Yes. Please remember that the manubrium opposite T3 and 4, the body 5 and 8, xiphoid T9. 5. Please. What is the name of it? Identify this name. Identify this structure.
Notch.
Notch. What is the name of this notch? Yes.
Suprasternal notch.
Yes, suprasternal notch. What is the vertebral level of this notch? Vertebral level.
2 and 3.
No, excellent. Between 2 and 3. Excellent. Suprasternal notch, because this is 3. Before 3 is 2. So suprasternal notch lies in between T2 and T3. Thoracic 2, thoracic 3. Okay. We shift to another. Who can identify the ribs?
First rib.
Where is the first rib? The right one or the...
The right one is
Right.
the
Yes, this is the first rib. No, good. What is the name of this structure? This is anterior or posterior?
anterior end.
And what is the name of this? Identify the name.
The head.
Head.
Neck.
Neck.
Tubercle.
Tubercle. Tubercle, yes. Yes, head, neck, tubercle. Head, neck, and tubercle. Okay. On the upper surface of the first rib here, you must identify two grooves. One groove near the anterior end here, and another groove here, posterior. We have two grooves.
Subclavian
artery and vein.
Which is the vein and which is the artery? This one is
Subclavian vein.
vein, and this is
The artery.
the artery. Subclavian. This is groove for subclavian vein and artery. It is very important for you to know that later, inshallah. Okay. What is the name of this rib?
Typical rib.
Typical, yes. Typical rib. Who can tell us what is the important feature in the typical rib?
Costal groove.
Where? It is lower or upper?
Lower border.
Yes, here. You will find here the groove near the lower border here. This is the costal groove. This is costal groove. What is structure inside the costal groove?
Vein.
Nerve.
Artery.
Vein, intercostal vein, intercostal artery, صح? Yes, intercostal nerve in the same order. Vein. This is related structure or the content of the costal groove. We go to the next slide. This is what? Name the muscles. This is direction. This muscle is directed. This is which is which?
External.
External, directed downward and medially or forward. Medially or forward. Now this muscle is internal muscles. This muscle is
Innermost.
innermost or maybe the lower transversus thoracic muscles. Three parts. Okay, what is the name of this muscle which is lie in the back of the chest wall near the vertebrae?
Costalis.
And the lie. Again?
Subcostalis.
Excellent. Subcostalis. What is the name of the muscles fan-like shape from the sternum to the costal cartilage like that? Sternocostalis. Yes, sternocostalis inserted where? If you see here from this picture, inserted in the second rib or the first rib?
Second.
Second, yes. Started insertions from the second up to reaching the sixth. Yes. Good. Excellent. Oh, what is structure? This is nasal cavity. We have here three conchi, superior, middle, and inferior. Identify. How many meatus here? 1, 2, and 3 meatus. Superior meatus, middle meatus, and inferior meatus. This is the hard palate, and this is the soft. Who can identify this sinus, paranasal sinus?
Frontal sinus.
Who can identify this paranasal sinus?
Sphenoid.
Sphenoidal. This bone.
Second.
This bone. Below the sphenoidal sinus.
Body of sphenoid.
Please, can you? It is not the body of the sphenoid, because the body of the sphenoid, this part, this is the basilar part of occipital bone. Basilar part of occipital bone or clavus. Okay, this is the base of the occipital bone. Okay. Who can count the vertebra here? This is number
1.
This is number
2.
2. What is this opening? Number 7.
Auditory.
opening.
What is the name of this number 8?
Salpingeal fold.
Yes, salpingopharyngeal fold. Salpingopharyngeal fold. And the number 6?
Adenoid.
Or nasopharyngeal tonsil. What is the name of this part of the pharynx?
Nasopharynx.
Yes, nasopharynx. Nice.
Doctor, can you repeat vertebra? Here?
Yes, the small one, it is like a dot, like that. It is the first one. Behind it, huh? Yes, here like that. Huh? This is the second one. Okay. Okay, easy.
Okay, thank you, doctor.
Ah, okay. Oh my God. Who can tell me this opening?
Auditory.
Auditory,
Identify.
inferior conch,
Identify.
Sphenoid.
Phonoidal.
Huh?
frontal, sinus,
Frontal. Identify.
Epiglottis.
Epiglottis.
Good. Excellent. Yeah, this is the larynx, yeah? Okay. Identify this vertebra number.
One.
This number.
2.
3, 4, 5, and 6, and 7, and so on. Okay. Nice. What is the name of this?
Sphenoid.
Sphenoid air sinus. Who can tell me this fold?
vestibular,
Vestibular and the focal cord.
Oh, what is the name of this cartilage?
Thyroid.
What is the name of this cartilage?
Cricoid.
cricoid,
And this cartilage?
Cricoid.
Cricoid.
Cricoid. Excellent. What is the name of this cartilage?
Epiglottis.
Epiglottis.
And this?
Thyroid.
Thyroid.
And this?
Cricoid.
Cricoid. This is a vestibular fold, huh? Vocal fold, and in between the
Sinus.
sinus. What structures open in the middle sinus? Or in the middle meatus?
Middle ethmoidal.
rema,
Model.
Okay.
the gap,
all open in the middle meatus except
The posterior ethmoidal.
excellent.
And sphenoidal. Sphenoidal.
And the sphenoidal, excellent. I make a fast revisions about everything, okay? Don't worry. Okay, let us go to the next slide. Oh. Who can tell me? Identify.
Diaphragm.
Nerve supply.
Phrenic.
Phrenic from roots. Its root value.
3, 4, 5,
C3, C4, and C5. What is the name of this opening?
Inferior vena cava.
At which level?
T8.
T8. Identify this opening.
Esophagus.
Esophagus. At which level?
T10,
Huh? This one.
Aortic opening.
At which level?
T12,
What is the name of this structure?
central,
Tendon of diaphragm. It is the insertion of diaphragm. It is only opening here. Only one opening in the central opening of diaphragm. Which is inferior vena cava, yeah. Inferior vena cava is open here. Who can tell me this vein?
Superior vena cava.
It is formed by the union of two veins. This one.
right,
Right and left
Brachiocephalic. What is the name of this arch? Arch of aorta? Yes. And this is the right lung, and this is the left lung. Okay, good. This is the trachea, okay? Okay, good. يا مسهل يا رب. Okay. Identify this cartilage.
Thyroid.
Cricoid, vestibular, vocal, and sinus. What is the name?
epiglottis,
Yes, nice. This is hyoid bone, girl. This is hyoid bone, okay? Hyoid bone, okay? This is the inlet here. This is the inlet. This is the cavity, supraglottic and infraglottic area or cavity, infraglottic, which lead to the trachea later. Yes, the same as we said before. This is epiglottis, thyroid cartilage, cricoid, vestibular, vocal, sinus, or cavity. This is epiglottis. This is a hyoid bone. Okay. This is thyroid cartilage. This is trachea. Name this muscle, please. Name this muscle.
Thyroid muscle.
Cricothyroid muscle. Yes. What is the nerve supply of this muscle? I love this muscle nerve supply. Huh?
External laryngeal nerve.
External
Yes,
laryngeal nerve.
external laryngeal nerve. From where? From Vegas, yes? From Vegas? Girl?
Yes.
Yes. Yes. What is the name of this muscle?
Cricothyroid.
Yes, the same. Cricothyroid. You are confused about this muscle?
No.
Okay. What, identify this nerve.
Internal
Laryngeal
laryngeal.
nerve.
Identify this artery.
Superior laryngeal artery.
Yes, this artery is a branch from superior thyroid, which is descending to reaching the thyroid gland. It's a branch from superior thyroid because this is a thyroid gland. This is internal laryngeal nerve with the artery also. This is the what is the name of this membrane?
Thyroid.
Yes, thyroid membrane, and this is the thyroid ligament. Okay, okay, girl. Go to the next one. Oh my God. Who can tell me number one?
Superior vena cava. Superior vena cava.
Superior vena cava. Huh? Number.
Right brachiocephalic.
Huh?
Left brachiocephalic. Trachea.
Yes. What is the part of the trachea?
Carina.
Carina. Which level? Which vertebral level?
T4.
Yes, T4. What is the name of this organ?
Esophagus.
Esophagus, yeah, esophagus. And is the trachea dividing into the bronchi, no?
Yes, primary.
To reach the lung. This is the lung, yeah? Right lung and lung. The same here in this one. Please identify.
Diaphragm.
Diaphragm, yeah, this is the diaphragm, which is the main muscle of respiration. Identify.
Superior vena cava.
False.
Right
Brachiocephalic.
Yes, good, excellent. And this one.
left.
And this one.
Superior vena
Yes, the same here, but this is narrow than the left one. Okay. What is the name of this structure?
Lingula.
Lingula. Yes, lingula. Okay. Okay. Please identify this cartilage.
Thyroid. Epiglottis.
Epiglottis. Well, this muscle.
Cricothyroid.
Muscle. Identify the cartilage.
Cricoid.
Identify the cartilage. Cricoid. Identify this one. Arytenoid. What is the name of this muscle on the back of the cricoid?
Posterior cricoarytenoid.
Yes, posterior. Cricoarytenoid. I told you this muscle is very important. Why?
Abduction of
Muscle of life.
Yes, muscle of life. Posterior cricoarytenoid. It is a muscle of life. It is very important than the heart. Why? It is abduction
of the vocal cord.
Abduction of the vocal cord. Okay. What is the name of the muscle in the posterior wall here of the trachea?
Trachealis.
Trachealis, yes. Okay. Which cartilage here single and which cartilage only
Cricoid is
cricoid is
finger.
single, thyroid
Single.
single, arytenoid
Double.
double, yes,
No.
pair, yeah. Which cartilage from these laryngeal cartilage at the level of C6?
Cricoid.
Yes, cricoid. Because this is a termination of the larynx and will go to the trachea. Okay. Yes, it is. Identify. Trachea.
Trachea.
And Karina, yes.
Karina.
And Karina.
Main bronchi.
Trachea.
Right.
And the right bronchi and the left bronchi.
And left bronchi.
Which one of these bronchi more in the same line of the trachea?
The right.
The right.
Right. So, what is the problem here?
Foreign body.
Foreign body.
Yes, foreign body will be
Foreign
impacted in the right lung more, yeah?
Likely to lodge in the right.
Yes, lodges in the right more. This is regarding to the impressions of the impression of the lung. This is
Left lung.
left lung.
Inferior surface.
Base, okay? This is a base. This is
Apex.
apex.
Posterior.
Posterior.
Border.
And
Interior border.
Identify this impression.
cardiac.
Cardiac.
Left ventricle.
Yes, identify this impression.
Descending aorta.
Descending.
Descending left.
Identify this impression.
Arch of aorta.
Arch of aorta.
Aorta.
So we can here after above the arch of the aorta, we can here identify this one, this one,
Thoracic duct.
this esophagus here, good, and this one,
Thoracic duct.
okay. Next, this one is
Subclavian artery.
yes, left subclavian artery.
Left subclavian.
Then
Left common.
Left common
carotid. Okay, regarding to the hilum, can you identify this vein?
pulmonary vein.
Inferior.
Inferior what?
Left upper pulmonary vein.
Or left lower?
Lower.
Lower inferior. This one?
Left lower. Left upper.
Left upper pulmonary vein.
This one?
Left pulmonary artery.
This one?
Left bronchus.
Left
Yes, the left pulmonary artery originating from where? What is the origin of the left pulmonary artery? Pulmonary artery originating from where?
Pulmonary.
From where?
Pulmonary trunk.
Yes, pulmonary trunk. Pulmonary trunk. Pulmonary trunk. Pulmonary trunk, which originated from the right ventricle. The right ventricle carry deoxygenated blood from the heart to the pulmonary trunk. Then the pulmonary trunk divided into two arteries, one right and one left, to each lung. Okay. Pulmonary vein. What is the termination of the pulmonary veins?
In the left arterium.
Yes, in the left atrium of the heart, which is receiving the oxygenated blood from the lung. Then this blood will go to the left ventricle. Okay, nice. Chatri. Okay, what is the name of this fissure?
Oblique.
Oblique. Who can describe this fissure? Yeah, starting from where to where?
From posterior border to the inferior
Yes,
border.
from the posterior border to the inferior border. Yeah. Okay. The inferior border of the lung, of the left lung or the lung as a whole, cut 3 ribs. Cut 3 ribs. What means by cut? surface anatomy. Who can remember?
يعني في impressions للريبس
No,
نفسها
no, no,
على
no,
اللنج.
no, 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 no. Just the these ribs are related to the inferior border of the lung. This is regarding to the surface anatomy. You know the surface anatomy? Huh?
Yes. Costal.
2, 3,
Huh?
6, and 3 and 4.
Girl, I will draw for you the surface anatomy of the lung because it is very important even in clinical. Here, this is a monobrum sterni, and this is the body of the sternum here, and this is xiphoid. Who can tell us what is the name of this rib?
Second rib.
Excellent. And here, number 6. But then this is number 2. This is number 6. Okay. Where the lung? The lung is starting in the neck above the clavicle by half an inch, then descending to the sternoclavicular joint, this right lung, and this is the left lung like that. Then go to the sternal angle here in the midline, then descending together in the midline like that till number 4. Till number 4, what happened? The right lung will continue down to number 6. But at the level of the number 4, the left lung deviate like that, then descending again to number 6 to make a cardiac notch. If you remember, cardiac notch. Okay? This is regarding to the anterior border of the lung. The inferior border of the lung, which runs like that here, it crossing 3 ribs. Rib number 6, then 8, then 10. Okay. Yes, 6. Please don't forget the inferior border of the both lung at the level of 6 and 8 and 10. طيب exactly 6 where exactly rib number 6 in the mid clavicular. Yes, in the mid clavicle. In mid clavicle. 9. I'm sorry. 8 in mid axillary. Mid axilla. And 10, 5 centimeter from the back. Yes, near the vertebrae. So then connecting the apex with the end of the inferior border, this is regarding to the surface anatomy of both lung. Like that. You remember, you imagine what happened? Girl.
Yes.
Easy? Yeah. The inferior border of both lung at the level of 6 and 8 and 10. 6 in the mid clavicle, 8 at the mid axillary, and 10 from the back. The pleura, the same. But what is the difference here? Who can tell me regarding to the inferior border?
The pleura 8. 8.
Please.
At the level of mid.
Just you can add 2. You can add 2 only. يعني number 6 will be number 8. Number 8 will be number 10. And the number 10 will be number 12. This is the surface anatomy of the pleura, of the inferior border of the pleura. Okay, 8 in the mid clavicle, 10 in the mid axilla, and 12 in the back. It is easy. Yeah, we have surface anatomy for the lung, inferior border, and we have surface anatomy for the pleura. Okay, we'll go to the right lung. It is easy, inshallah. Right lung. Identify this impression.
Right atrium.
Yes. This vein.
Superior vena cava.
Yes. And here.
Inferior vena cava.
Here.
right brachiocephalic.
طيب. Above the hilum direct.
Arch of esophagus.
Arch of azygos. Behind
Esophagus.
azygos. Here.
Esophagus.
And esophagus also will continue here. So?
Yes.
طيب. What is the structure here?
Trachea.
Yeah. We have two fissures here, yeah?
Yes.
What is the name of this fissure?
Oblique.
fissure.
And?
Transverse.
Or horizontal, yeah. Easy, easy. Who can tell us the blood supply of the lung? Blood supply or artery? Blood supply of the lung.
Bronchial arteries.
Yes. Pulmonary arteries first, okay? Remember the structure of the content of the hilum, pulmonary artery. Oxygenated or deoxygenated blood?
Deoxygenated.
Pulmonary?
Veins.
Oxygenated blood. We have two veins, upper and lower, okay? And terminating in the left atrium, as we said before. We can add here arteries as the posterior wall of the bronchus, named bronchial artery. Bronchial what? Artery. The bronchial artery here we have on the right and on the left. On the right lung, we have one artery. On the left lung, we have two arteries. On the right lung, it is originating from the right third posterior intercostal artery. And the left lung here originating from the aorta direct. And also here we're having a bronchial vein. The right one,
And in the esophagus.
azygos, and the left one in the hemiazygos. Yes. This is regarding to the blood supply of the lung. Please, this is for you, even in clinical. Please don't forget this. Okay. Okay.
Okay.
Let you ask any questions. Asking any questions. Please ask. I made a very fast revisions for
Doctor, can you send the slides اللي سويتها هذه؟
I will try إن شاء الله.
Okay, thank you, Doc.
دكتور كم سؤال بيجي على الاناتومي في الاوسبي؟
I don't know. I think from coordinator.
دكتور المصل حتيجي على الكاديفر ولا لا؟ المصل حتيجي على الكاديفر؟
As we trained before.
اوكي طيب الاكسترنال احنا ما راح نشوف الكاديفر الا على برا الاكسترنال مصل ولا؟
As we train, anything you saw in the lab or here.
Okay, thank you.
Okay. I wanted to from you to ask questions related to this topics. If you have any questions.
دكتور في المانديبولار نوتش لو كتبنا مثلا إنه at level of 2 بس بدون ما نكتب between 2 أو 3.
This is not named the mandibular notch, named suprasternal notch or jugular notch. Okay.
Okay.
You can write between 2 and 3 or at the lower border of the 2. Okay.
Okay. دكتور اسمها بعد clavicular notch ولا؟
Yes. After that, it is named clavicular notch on the side. Any question? Any question, girl?
يعطيك العافية دكتور.
شكرا جزيلا.
Thank you.
موفقين إن شاء الله. موفقين. يا السلام عليكم.